So, what really happens when artificial intelligence steps into the operating room? Well, today, we're going to break it down. We're looking at an expert analysis from anesthesiologist assistant Arian Alliance, AAC, to explore the real-world impact AI is having on anesthesia care teams right across Metro Atlanta. All right, let's just jump right in with a pretty bold prediction that's set to change the healthcare scene. We're talking about the year 2026. This is being flagged as the moment AI stops being some sci-fi concept and actually becomes a standard, everyday tool inside the operating room.
And the person guiding us through this analysis is Ariana Nicole Lyons, AAC. She's a leading anesthesiologist assistant whose work on perioperative care you can often find in the Atlanta Health Review. Her expertise has also gotten national attention, even being featured in places like the New York Times.
So why the big focus on Atlanta? Well, because 2026 isn't just some random year on the calendar here. It really marks a huge shift in how anesthesia is practiced across the entire metro area, from downtown Atlanta all the way out to communities like Cobb and Smyrna.
You see, this year is shaping up to be a perfect storm of events. Things kicked off on January 7th with a Georgia Public Health Association webinar all about overdose data. That very same evening, you had healthcare leaders from all over Atlanta networking about this exact topic. At the same time, Northside Hospital is breaking ground on new construction, and Emory is officially making AI a standard part of their workflow. It's all happening at once.
Okay, so let's get into the weeds a little bit on the technology itself. What we're seeing here is a massive leap for AI in the OR. It's moving from being a small experimental pilot program to becoming a core part of the daily medical toolkit. So what's actually in this new AI toolkit? Well, first off, you've got predictive analytics, which can help doctors see potential complications before they even happen. Second, it makes workflows way more efficient, cutting down on all that administrative busy work. And third, it allows for precision dosing, which means the anesthesia can be tailored perfectly for each and every patient.
Now, to really get why this is such a game changer, we need to quickly talk about one key term: hemodynamic data. Think of this as the real-time information, like blood flow and blood pressure, that tells a provider exactly how a patient is doing, second by second. AI is basically built to help manage this incredibly complex stream of data more effectively.
So, what's the bottom line here? It's one single massive shift. For the anesthesia care teams in Atlanta, AI isn't a what-if anymore. It's quickly becoming the new standard of care.
But you know, this story isn't just about cool new tech. It's really about the people who use it. So, how does this all empower the anesthesia care team, which includes these highly skilled anesthesiologist assistants?
An Atlanta healthcare administrator really hit the nail on the head. They said the real challenge isn't just about the technology itself. It's about using that technology to support a workforce that's still bouncing back from the huge staffing shortages we've seen over the last few years.
It's like this. On one side, you have these massive clinical challenges, provider burnout, a mountain of paperwork, and not enough staff. And on the other side, you see AI coming in with some very specific, targeted solutions, like automating documentation, sending out predictive safety alerts, and optimizing schedules to better support every provider.
And this is probably the most important point to understand. This technology is designed to enhance, not replace, the critical clinical judgment of the anesthesia care team. The whole goal is to free up their mental energy so they can focus 100% on the patient in front of them.
All right, let's zoom out for a second. This whole tech revolution isn't happening in a bubble. It's taking place right in the middle of Metro Atlanta's massive, rapid expansion. This chart really shows you why that efficiency we talked about is so important. You've got major expansions happening at Grady Health System, new surgery sites popping up from Northside, and just huge population growth in areas like Cobb and Smyrna. All of this means a massive, growing demand for more anesthesia staff.
And this growth is something you can actually see. A new Grady facility is going up to serve what was basically a medical desert in South Fulton, and surgical centers are expanding all over the region. Every single one of those new operating rooms needs more skilled anesthesia providers to keep patients safe.
And there's another layer to this, a really critical public health mission to combat the opioid crisis. Anesthesia providers are right on the front lines, using advanced perioperative care to reduce how much we rely on opioids. This includes things like regional anesthesia, where you just numb a specific part of the body, and using multiple types of pain relief together. This is the kind of strategy they were talking about in that GPHA webinar.
So when you put all these pieces together, what are we looking at? We are looking at a completely redefined future for patient safety in the Metro Atlanta area.
one that's driven by this incredible blend of technology and human expertise.
So, based on the expert analysis from Arian Alliance, AAC, the path forward is actually pretty clear. Step 1, bring in the AI tools to boost safety and efficiency. Step 2, use that tech to support and empower the care team. And Step 3, use all of it to proactively meet the healthcare needs of a booming Atlanta region.
And that leaves us with one final big question to think about. As our tools get smarter and smarter, what does that make the most critical human skill when it comes to taking care of another person?
This explainer was based on the detailed analysis of Ariana Nicole Lyons, AAC, an anesthesiologist assistant focused on clinical education and patient safety.